My name's Bruce Keogh. I'm Medical Director of the NHS. Your Enhancing Quality programme, in my view, is so important. It's clinically led, data-driven, and focused on patient outcomes. A very, very potent cocktail which I think can lead to nothing but improvement. I see that you've taken the main issues from the Northwest and that you've developed those further in the way that you've implemented the program. And I also see with a degree of excitement actually that you're adding in dementia and acute kidney injury. Both of these are really important, and I have to say that from a personal perspective, as medical director, one of the areas that I'm keen to make an absolute priority for the NHS is a focus on dementia, because I believe that we're about to see an even greater effect of dementia on our healthcare services than we're seeing at the moment, and that we need to be prepared for that. And it's the sort of initiatives which you're undertaking which will put us into a good position to understand what the impact potentially is and how we can alleviate it in the best interest both for the health service and of our patients. Now, I've been involved in data collection and establishing clinical databases in this country, North America, and in other parts of the world. So I have a pretty clear idea of how difficult this is. It is not easy. I think getting people to become data focused is initially seen as a bit of an imposition, and it's only when people begin to realize that the hassle of collecting data is far outweighed by the utility of the information that comes from that you start to get the kind of mindset changes and subsequent enthusiasm that lead people to the position that you're currently in at the moment. So I think there's a big thank you to those of you that have stuck with it, that have helped to develop the enthusiasm, and who have got your initiative to the place that it is at the moment. So you have enormous support and respect from me, because I really do understand how difficult this is. One of the other opportunities I think that we have for the NHS at the moment around this data collection initiative is to have a pretty coherent approach to the way we handle data in the NHS. What we're trying to create at the moment is a focus on outcomes that is meaningful to clinicians and has impact on patients. If we do that, we can win. If we don't do that, then we've failed in this endeavour. And what I'm sensing from what I've seen of your work is that the former will prevail. I think you've made fantastic use of the opportunities that have presented themselves. You're doing a great job in trying to align what you're doing with the greater national picture, which is in the interests of not just the NHS, but our society at large. So congratulations on what you've done, and I wish you the very best for a day and hope that you have a successful outcome. Keep it up. Which underpinned a compassionate and loving